Gentlemen, let me ask you a question that most men think about but rarely say out loud. What actually happens if you ejaculate every single day? Is it healthy? Is it harmful? Could it boost your performance? Or is it secretly draining your energy over time? If you've ever wondered about this, you're not alone. I hear this question constantly in my clinic from men of all ages. It's one of those topics that lives in the shadows, half whispers, myths, even guilt. And yet, it's absolutely central to men's health, relationships, and confidence. Today, we're breaking that silence. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men take charge of their sexual and overall health. And in this video, I'm going to give you the full picture, the 5 surprising benefits of ejaculating daily, the 5 potential drawbacks you need to watch out for, and most importantly, how to know what's right for your body, your goals, and your stage of life. Stay with me until the end, because I'll also share the exact age-specific frequency guide that most doctors never talk about, and a simple protocol to figure out what works best for you. But first, tell me in the comments, where are you watching from today? I love seeing this community grow from all around the world. Now let's get into it. But let me clear up the biggest misconception right away. There is no universal answer. Ejaculating daily isn't automatically good, and it isn't automatically bad. The truth is far more nuanced than that. It depends on why you're doing it, how you're doing it, and what impact it's having on your body and your mind. Some men thrive on a daily release. They sleep better, feel less stressed, and walk through life with more confidence. Others find that it dulls their desire, drains their energy, or even creates performance issues over time. So the truth isn't black and white. It's about context, your biology, your habits, and your life stage. Now, let me reassure you of something important. If you felt unsure or confused about this topic, it's not because you're ignorant. Most men were simply never taught how their bodies truly work when it comes to sexual health. There's no class for this, no manual, just locker room talk and internet confusion. That's exactly why I've made it my mission, after more than 10 years as a urologist, to break down complex science into simple, practical advice you can actually use. So think of this conversation as doctor to friend. My job isn't to lecture you, it's to help you understand what's happening inside your body so you can make informed choices, not live by myths or fear. And with that foundation, let me explain what actually happens when you ejaculate, because understanding the science will help everything else make sense. When you reach orgasm, your brain doesn't just experience pleasure. It releases a powerful cascade of chemicals that affect your entire body. First, there's a surge of endorphins, your body's natural painkillers. These create that wave of euphoria and relaxation you feel immediately after climax. At the same time, your brain floods with dopamine, the reward chemical. This is what makes the experience feel so satisfying. It's the same neurotransmitter that motivates you, energizes you, and makes you feel alive. Then comes oxytocin, often called the bonding hormone. It builds feelings of connection, trust, and emotional closeness. This is why intimacy with a partner often feels different than solo release. Your brain also releases serotonin, the mood stabilizer that keeps your emotions balanced and helps you feel calm and content. And finally, there's prolactin. This hormone promotes deep relaxation and drowsiness. It's also what triggers your refractory period, that recovery window before you can become aroused again. Now here's something crucial that changes everything as you age. That refractory period isn't fixed. In your 20s, recovery might take just minutes. In your 50s, it could stretch to several hours. And in your 60s and beyond, it may extend to a full day or even longer. This isn't a sign that something's wrong, it's simply biology. And understanding this helps you work with your body instead of against it. Now that you know what's happening inside, let's talk about why regular ejaculation can actually be good for you. And some of these benefits might genuinely surprise you. Benefit number 1, pleasure hormones, and mood regulation. Ever notice how relaxed you feel? Afterward, that wave of calm that washes over you? That's not your imagination, it's neurochemistry. When you ejaculate, that cocktail of endorphins, dopamine, oxytocin, and serotonin essentially resets your nervous system. It's like hitting a refresh button on your brain. Biologically, this release calms anxiety, lifts your mood, and helps you feel more emotionally grounded. Emotionally, it means less tension building up inside you, less snapping at loved ones over small things, less bottled up stress that has nowhere to go. Practically speaking, daily release can become like a natural reset button. It's not a cure-all for life's problems, but it provides gentle, consistent support for your mental health. I've had patients tell me they feel more patient, more present, and more emotionally available after making this a regular part of their routine, and science backs them up. Benefit number 2, better sleep quality. Have you ever noticed feeling heavy-eyed after sex or masturbation, like your body just wants to sink into the mattress and drift off? That's because of prolactin, the hormone I mentioned earlier that promotes deep relaxation and sleepiness. When you combine prolactin with the stress-reducing effects of endorphins and oxytocin, you've essentially got a built-in sleep aid. For men who struggle with racing thoughts at night, chronic stress, or even mild insomnia, this can be genuinely transformative. Biologically, it triggers your body's natural relaxation response. Emotionally, it offers relief from those restless nights where your mind just won't shut off. Practically, it means falling asleep faster, staying asleep longer, and waking up with better recovery and sharper focus the next day. I can't tell you how many men have told me that this simple change improved their sleep more than any supplement or medication they'd tried.
Benefit number 3, improved blood flow and circulation. Here's something most men don't realize. Orgasm isn't just a brain event, it's full-body exercise. During arousal and climax, your blood vessels dilate, your heart rate increases. Circulation ramps up throughout your entire body. This process, called vasodilation, helps deliver oxygen and nutrients to your muscles, your brain, and yes, your reproductive organs. Think of it like a mini cardiovascular workout. You're essentially training your vascular system to stay responsive and healthy. Biologically, this matters enormously, especially as you age. Emotionally, there's a confidence boost that comes from better erection quality. When blood flow improves, firmness improves. Practically, this helps keep your cardiovascular system in shape. And here's the connection most men miss. The same blood flow that powers your heart is the same blood flow that powers your erections. They're not separate systems. They're deeply connected. Regular sexual activity keeps those pathways open and responsive. Benefit number 4, lower risk of prostate cancer. This is one of the most compelling findings I share with my patients, and it often surprises them. A major Harvard study followed over 31,000 men for nearly 20 years. What they discovered was remarkable. Men who ejaculated 21 times or more per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated less frequently. Why would this be? The leading theory is that ejaculation helps flush out the prostate gland, removing old cells, inflammatory agents, and other biological buildup that could otherwise increase cancer risk over time. Think of it like this. Your prostate produces fluid that becomes part of semen. Regular ejaculation keeps that system moving, clearing out potential problems before they accumulate. Biologically, it's a natural cleansing process your body is designed to perform. Emotionally, this offers real reassurance about one of men's biggest health fears. Prostate cancer affects 1 in 8 men. Knowing that something this simple might offer protection is genuinely empowering. Practically, it means sexual activity may play a real role in protecting your prostate health, though of course, it's not a substitute for regular checkups with your doctor. I'm not saying ejaculation prevents cancer, but the evidence strongly suggests it may be one important piece of a protective puzzle. Benefit number 5, immune system support. Here's a bonus benefit you probably didn't expect. Studies have shown that sexual arousal and orgasm can boost levels of immunoglobulin A, or IgA. This is one of your body's first-line defenses against viruses and bacteria. It's found in your saliva, your respiratory tract, and your gut, all the places where pathogens try to enter. When you combine this immune boost with the stress-reducing effects of regular ejaculation, and remember, chronic stress weakens immunity, you get subtle but real support for your body's defense system. Biologically, you're strengthening your shield. Emotionally, there's peace of mind in knowing you're supporting your overall health. Practically, it's yet another reason why sexual health isn't separate from your general wellness. They're the same thing. Now, before we move on to the risks, there's something critical I need to share with you. Something most videos completely skip over. The Harvard researchers didn't just find that frequent ejaculation helps. They found that the optimal frequency changes depending on your age. This is where it gets really interesting. If you're in your 40s, the research suggests that 13 or more times per month, roughly 3 to 4 times per week, offers the strongest protective effect. Men in this age group saw a 28% reduction in prostate cancer risk at this frequency. Your testosterone is still relatively robust, your recovery time is shorter, and your body can handle more frequent release without feeling drained. If you're in your 50s, the ideal frequency shifts slightly. Around 10 or more times per month, roughly 2 to 3 times per week, seems to hit the sweet spot. Here's why. Your testosterone is naturally declining by about 1 to 2% per year at this stage. Your body needs a bit more recovery time between sessions. Pushing for daily ejaculation might leave you feeling depleted rather than energized. And if you're in your 60s or beyond, even 4 to 8 times per month, roughly once or twice per week, still offers significant protective benefits. Your refractory period may now extend to 24 to 72 hours, and that's completely normal. At this stage, the focus shifts from frequency to consistency. What matters isn't hitting a number. It's maintaining regular activity over time. Here's what I want you to remember. These aren't rigid rules carved in stone. They're guidelines based on research. The real answer, the one that matters most, is what your body tells you. Pay attention to your energy levels. Notice your mood. Track how you feel the day after. Your body will give you the answers if you learn to listen. Now, let's talk about the other side of this conversation. Because I have to be honest with you, daily ejaculation isn't risk-free. For some men, it can actually backfire. Here are the 5 drawbacks you need to watch out for. Drawback number 1, compulsive behavior. There's a massive difference between a healthy habit and an unhealthy compulsion. And this distinction matters more than most men realize. If you're choosing daily ejaculation consciously, for pleasure, for stress relief, for intimacy with your partner, that's one thing. You're in control. You're making a decision that serves your well-being. But if you feel controlled by the urge, if it starts interfering with your work, your relationships, your ability to focus, if you find yourself doing it not because you want to, but because you feel like you have to, then it's veering into compulsive territory. Biologically, compulsive patterns can actually rewire your brain's reward system, making it harder to feel satisfaction from other areas of life. Emotionally, compulsion breeds guilt and shame, the opposite of what healthy sexuality should create. Practically, it drains your time, your focus, and often your intimacy with partners. Here's the key question I want you to ask yourself honestly. Am I choosing this, or is it choosing me? If you're not sure of the answer, that itself might be worth exploring. Drawback number 2, using it as an emotional crutch. We all face stress, boredom, loneliness, sadness. These are part of being human. But here's where things can get problematic. If ejaculation becomes your only coping tool, your go-to response every time you feel uncomfortable emotions, it may be masking deeper needs that aren't getting addressed. Biologically, you create a dependency on one single pathway for emotional relief. Emotionally, it can prevent real healing. You're numbing the symptom without treating the cause. Practically, it keeps you from building healthier outlets. Exercise, journaling, meaningful connection, or even professional support when needed. Let me be clear, there's nothing wrong with using sexual release as one way to manage stress. The problem arises when it becomes the only way. Ejaculation should be one tool in your wellness toolkit, not the only tool. Drawback number 3, lower sperm count, if you're trying to conceive. Now, if you're not trying to have children, this won't concern you. But if you and your partner are working toward pregnancy, this is important to understand. Daily ejaculation can temporarily lower your sperm concentration. It doesn't damage your fertility permanently, but it does reduce the number of sperm available in each release. Biologically, your body needs time to replenish its sperm supply. That process typically takes 48 to 72 hours. Emotionally, this can create real stress for couples who are already struggling with fertility challenges. Practically, spacing out ejaculations to every 2 or 3 days during your partner's fertile window may actually improve your chances of conception. This isn't about abstinence, it's about strategy, working with your body's natural rhythms rather than against them. Drawback number 4, reduced sensitivity or desire. Here's a paradox that catches many men off guard. Too much of a good thing can actually blunt your ability to enjoy it. Daily ejaculation, especially when it becomes rushed, routine, or purely mechanical, can lower your physical sensitivity over time. It can also reduce spontaneous desire, that natural hunger for intimacy that makes sex exciting. Biologically, what's happening is adaptation. Your brain adjusts to frequent dopamine releases by dampening its response. The same stimulus that once felt electric starts feeling ordinary. Emotionally, this can create a flat, unmotivated feeling. Like something's missing, but you can't quite name it. Practically, you might notice less arousal when you're actually with your partner. The spark that used to ignite easily now takes more effort to light. The good news? This is completely reversible. Short breaks, even just a few days, can reset your sensitivity and restore that spark. Sometimes stepping back is the best way to move forward. Drawback number 5, performance issues, especially if you're rushing. This is one I see frequently in my practice, and it's important to understand. If daily ejaculation happens through quick, hurried stimulation, racing to finish as fast as possible, your body learns that pattern. Your nervous system adapts to what I call sprint mode. Over time, this conditioning can lead to premature ejaculation or performance anxiety when you're actually with a partner. Your body has been trained for speed, not rhythm, for release, not connection. Biologically, your nervous system becomes wired for rapid completion. Emotionally, this creates frustration for you and for your partner. Practically, it undermines the very confidence you're hoping to build. The fix isn't complicated, but it requires intention. Slow down. Practice what's called edging, bringing yourself close to climax, then backing off. Focus on breath control. Approach stimulation mindfully rather than mechanically. Train your body for rhythm, not just release. The payoff in your intimate life will be worth it. So, what's the correct answer here? How do you take everything I've shared and actually apply it to your life? Daily ejaculation isn't inherently good or bad. The key is asking yourself 3 honest questions. First, why am I doing this? Is it for genuine pleasure, stress relief, intimacy, and connection? Or has it become compulsive? Something I feel driven to do rather than choosing to do. Second, how is it affecting me? Am I sleeping better and feeling confident? Or am I noticing fatigue, emotional flatness, or creeping guilt? Third, does it fit my current goals? If I'm trying to conceive, do I need to adjust my frequency? If I'm feeling disconnected from my partner, is my solo habit part of the problem? So here's a simple 4-step protocol you can follow starting today. Step 1. Pay attention to your body. For the next 2 weeks, track your energy levels, your mood, and your libido. Just observe without judgment. Step 2. Experiment. Try your current frequency for 1 week, then try spacing things out, maybe every 2 or 3 days, for the following week. Compare how you feel. Step 3. Find balance. Make sexual release one tool in a larger wellness approach that includes good sleep, movement, stress management, and real human connection. Step 4. Communicate. If you have a partner, talk about what's working and what isn't. Intimacy thrives on honesty. And one critical warning, never ignore changes in erection quality, pain during ejaculation, or any prostate symptoms. Those deserve proper medical evaluation, not just internet research. Let me tell you about a patient I'll call Robert. He's 64 years old, and he came into my clinic feeling completely defeated. "Doc," he said, "I thought at my age things were just done." Robert had been ejaculating daily for years, not out of desire, out of habit. It was just something he did, almost automatically. But over time, he'd started feeling drained, disconnected from his wife, convinced that his body was failing him and there was nothing he could do about it. We talked through everything I've shared with you today, and we made one simple adjustment. Instead of daily, Robert spaced his ejaculation to every 2 or 3 days. Within a month, everything shifted. His energy came back. His desire returned. Real desire, not just routine. And most importantly, he reconnected with his wife in ways he hadn't experienced in years. Robert isn't an exception. I see this kind of transformation constantly, in men in their 50s, their 60s, even their 70s. Small adjustments creating massive changes in quality of life. If you felt shame around this topic, confusion, or even fear, I want you to know something important. You're not alone. Sexual health is human health. Asking these questions doesn't make you weak or weird or broken. In fact, it makes you wise. Because the more you understand your body, the more freedom and dignity you gain in your daily life. Here's the truth I want to leave you with. Ejaculating every day can be perfectly healthy for some men. For others, it can signal habits that need a little rebalancing. This isn't about following rigid rules or feeling guilty about natural urges. It's about self-awareness. It's about listening to your body and making choices that serve your energy, your relationships, and your long-term health. And here's the most empowering part of all. You have the power to adjust. Small changes, whether that's adding a short break, slowing down your approach, or shifting from mechanical release to genuine connection, can transform your energy, your confidence, and your sense of control. Age is not the end of vitality. Whether you're 50, 60, or 70, your body can adapt. Your health can improve. Your confidence can grow. So keep learning, keep listening to your body, and keep building the kind of life that brings you comfort, freedom, and strength. If you found this video helpful, subscribe for more honest men's health content each week. And share your thoughts in the comments below. I read every single one, and this community means the world to me. I'm Dr. Lila Romano, and I will see you in the next video.